All. This is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. So, the discussion today is about the unexplained hepatitis that has been increasing. The cases are on the rise. It is sort of an outbreak in the younger children, mostly below 5 years of age, but there are other variations for age as well. And it is unexplained that there is actually the hepatitis viruses are negative in these children. These children are also, majority of them, for example, UK and Scotland, these children under 5 years of age are not vaccinated either. However, the severity of hepatitis is so much that some children needed liver transplants. So, for example, in Scotland, there were 5 cases since January till now, while they say that such intensity of hepatitis is seen maybe about 4 or over 4 cases in a year. So this is a higher count. So with this, let's start our discussion. This discussion is important for clinicians as well because they have to be alert for this situation, for the hepatitis occurring in the young children, and they have to have a lower threshold to reach out for consultation or for referral. So let's start our discussion. So this is DrBeen.com. In the description, there is a link that you can use to purchase the premium account, and that price is really low. It's not even 2 lunches. So check it out. So I'm going to discuss 3 reports today. This is UK's report. This one is Alabama, US. And this one is Scotland through Eurovision. Then there are some other references here as well that kind of shed some more light. And this is Dr. Bean, Cool Bean Cafe that you can join afterwards for chit chat. So let's start our discussion. I'm going to start with a summary first, and then we'll go over the details as well. So here is a summary. So starting from what is the most important message for clinicians? We'll go in the details of the situation later on, but for clinicians, so this is UK. Clinicians are asked to be aware of potential new cases of unexplained acute hepatitis in children aged 16 years or under, with a serum transaminase of greater than 500 international units per liter. So that is AST or ALT. Then all staff involved in the care of these children should use standard IPC precautions and optimal placement in a single suite room whilst the patient is considered infectious and until resolution of symptoms. So take care. Follow protocols that would normally apply in the investigation of acute hepatitis and handling of specimens. There should be a low, so this is the important part, there should be a low threshold for seeking expert clinical support from or specialist referral to one of the 3 pediatric liver centers, King's College, Birmingham Women's and Children's, and Leeds Teaching Hospital. Again, based on the country, this could change. But once again, important thing is for a general practitioner, the threshold to consult a specialist or to refer to a specialist should be lower at this time for younger children, and especially for the children that are unwell and deteriorating. Now, this is an important set of information because there are lots of, because this is mysterious, there are lots of theories going around as well. So I wanted to make sure that we are aware of some of these facts. Number one, the children below 5 years of age are not cleared for vaccination in UK. So all the children in this report, so from the UK, the report was actually produced by Dr. Rachel Taylor and her colleagues. So all the children in her report that we will go over today were under 5. So again, once again, it's a sad situation, and some children needed transplant as well. But they were all unvaccinated children. And while we are on this case, they suspect that this may be adenovirus. And I'll discuss it why it may be adenovirus. This is again a suspicion. This is from Scotland. It's not confirmed. Now, if you see here, this is the Scotland's report. Other infectious causes still being explored. So hepatitis A, B, C, D, E, they were not present. So other infectious diseases still being explored include increased severity of disease following infections with Omicron BA2, the dominant SARS-CoV-2 virus circulating in Scotland, or infection by an as yet uncharacterized SARS-CoV-2 variant. This is Scotland saying we are trying to look into this direction as well. Of note, none of the children were vaccinated for SARS-CoV-2. This is Scotland. A novel or yet undetected virus also cannot be ruled out at this time. So maybe there is altogether a new virus. Now let's go over highlights of the reports. Then we'll go over the details of the reports as well, because once again, there are important messages for clinicians for what to look for in the presenting complaints or the way the patient is presenting and what to do. So we'll look at the UK's report, we'll look at Alabama's report, and we'll look at Scotland's report. So situation in the UK. So United Kingdom, April 8th, 2022, that is their report's date. So if you see here, this report's date is published 8 April 2022. In England, there are approximately 60 cases under investigation, with most cases being 2 to 5 years of age. Some cases have required transfer to specialist children's liver units, and a small number of children have undergone liver transplantation. So that's the sad part. Based on reports in the specialist units, no child has died. The underlying cause of this increase in presentation since early 2022 currently remains unknown. That is UK. So clinicians are asked to be aware of potential new cases of unexplained acute hepatitis in children aged 16 years or under with a serum transaminases of greater than 500 international unit per liter. So this is very important, and this could be AST or ALT, greater than 500. Then they say cases of acute hepatitis in children up to the age of 16 years with a serum transaminase of greater than 500 IU per liter, in which hepatitis, so what are the characteristics of the patients to be careful about, in which hepatitis A to E has been excluded, should be notified to the health protection teams by telephone between 9 a.m. This is UK. So if you have ruled out the common reasons for hepatitis and you still feel that the patient has hepatitis, or you can see that the patient has jaundice or other signs and symptoms of hepatitis, but there is no explainable cause, then immediately report them. Now, Alabama, US. So since November 2021, the Alabama Department of Public Health is collaborating with pediatric healthcare providers, including hospitals who treat children, and the Center of Disease Control, CDC, has been investigating an increase in hepatitis in young children. So the symptoms in Alabama: GIT illness, gastrointestinal symptoms, varying degree of liver injury, including liver failure. Later analyses have revealed a possible association of this hepatitis with adenovirus 41. So this is the most common association you would see. You would see that with the Scotland as well. And Scotland, in their report, have actually presented a conjecture as well for why. They think that as the children have spent, these younger children have spent a lot of time indoors during the pandemic, they have become kind of immune naive for adenoviruses. Excuse me. And usually, adenoviruses do not cause such severe disease, but a child who may be immune naive and is getting exposed now may have an overwhelming response by their immune system, causing this kind of hepatitis. So, that is their hypothesis. To date, so again in the US, to date, children less than 10 years old have been identified as positive for adenovirus, and 2 have required liver transplant. So there is an association with adenovirus. And there is a reason that is explained not by Alabama's report, but by Scotland's report. And again, that reason may be incorrect. And these are investigations that are continuing. And as we learn more, we will either do a new report or we'll edit this one. We'll see what happens. But this information is going to change. Now, situation in Scotland. On 31 March 2022, the Scottish National Health Service, Greater Glasgow and Clyde Health Board alerted Public Health Scotland to 5 children aged 3 to 5 presenting to the Royal Hospital of Children, Glasgow, with severe hepatitis of unknown etiology within a 3-week period. So within that 3-week time, the typical number of cases of hepatitis is of unknown etiology across Scotland would be fewer than 4 per year. So in the whole year, fewer than 4. And I stand corrected. In the beginning, I said more than 4. So fewer than 4 in a year versus 3 to 5 years of age. Now, how many? 5 children within 3 weeks. So most children presented with transaminases greater than 2000. And normal range is 10 to 40 international units per liter. And they had 2000. So that is indicative of severe liver damage. Initial screening for hepatitis A, B, C, and E was negative, with 1 hepatitis E result pending. As an indicator of disease severity, 3 children were transferred to quaternary pediatric liver units in England to be evaluated for liver transplant, with 1 receiving a transplant. So 1 receiving a transplant in Scotland, then as you saw here, 2 requiring transplant in Alabama, and in UK they said a small number. They didn't give you the exact number, but if you see here this red one, small number of children have undergone liver transplantation. So clearly a very serious situation. So details. So I'm going to go over these labs and these presentations, so one by one. So first of all, UK. So now we're going to the detail. If you just wanted to understand what is this summary, what is happening, this is what's happening. There is unexplained severe hepatitis, sometimes requiring liver transplant in younger patients. And this outbreak is seen in multiple countries. So that is the summary. Now, again, for clinicians, this is important to look at the presentation and then the type of labs to do. So UK has done a great job of saying what kind of labs are needed so that you can rule in and rule out various possibilities. So I'm not going to go over the whole report. There are some things that are interesting. So the clinical syndrome in identified cases of severe acute hepatitis with markedly elevated transaminases, often with jaundice, sometimes preceded by GIT symptoms, including vomiting as a prominent feature. So jaundice is usually an important indicator for hepatitis. So jaundice, GIT symptoms, nausea, vomiting. In children up to the age of 16 years in England, there are approximately 60 cases. Some cases have required transfer, so we talked about that. Now, here, look at this. Clinicians are asked to be alert to this emerging situation. And down here are the various signs and symptoms to look for. Number one, discoloration of urine, dark and or feces, pale. So that is important. Jaundice, pruritus. When bilirubin increases as a result of the liver damage, the when it is deposited under the skin, it causes itching or pruritus. Arthralgia, myalgia, muscle pains, joint pains, pyrexia, fever, nausea, vomiting or abdominal pain, lethargy or loss of appetite. So GPs should be alert to children presenting with symptoms compatible with acute hepatitis and seek advice on the local trust. So I have gone over this part separately. Here I want to share this, and this is very important. So if you are a practitioner, clinician, I think that they did a great job here, UK, that they presented for what labs to do. So they said do blood PCR for adenovirus, enterovirus, CMV, EBV, HSV, hepatitis A, C, E, HHV 6 and 7. So PCR for these. Serology, that is antibodies, for hepatitis A, B, C, E, CMV, EBV, SARS-CoV-2, and anti-SARS-CoV-2, anti-N, only if locally available. Blood culture, standard culture for bacterial, fungal, only if indicated. That is if there is fever. Fever is usually, especially high grade fevers, are indicators of bacterial or fungal infection. Throat swab PCR, respiratory viruses, panel including adenovirus, enterovirus, influenza, and SARS-CoV-2. Stool PCR, adenovirus, sapovirus, norovirus, enterovirus, standard bacterial stool pathogen panel to include Salmonella, Saprophyticus, or stool culture depending on local test availability. Blood, whole blood in EDTA and plasma separated specimen, toxicology, local investigations according to history, store samples locally, and UK health department would contact. Urine toxicology, local investigations according to history, store samples locally, and they would contact you. Positive results should be reported following usual process. So then they're saying that in addition to that, following additional tests are relevant if you can, and so here are those tests as well. So once again, clinicians wishing to discuss testing for any acute case of unexplained hepatitis with serum transaminase of greater than 500 IU per liter in a child age 16 or under should contact this service. So this is UK. It's a sad thing that all of a sudden there is an outbreak. Now, Alabama. So here, I want to once again go over some of the things that they have added to the discussion. So first of all, they're suspecting that this is adenovirus. So what they're saying is adenoviruses are common viruses that typically cause a mild self-limiting flu like a GIT illness. Rarely in otherwise healthy individuals do these viruses cause an illness so severe that they need to be hospitalized or may die. So that is this discussion. Adenoviruses are usually spread from an infected person to another through, so this is important, closed personal contact, such as touching or shaking hands, the air by coughing and sneezing. So remember, adenoviruses can cause common cold type symptoms, flu-like symptoms. Touching an object or surface with adenovirus, fomites. Then touching your mouth, nose, or eyes before washing your hands. Contact with stool, for example, during diaper changing. Adenoviruses are often resistant to common disinfectants and can remain infectious for a long period of time on surfaces and objects. So basic steps individuals can take to protect themselves. Again, I think we in the pandemic have seen this. Wash your hands for 20 seconds. Help your child wash their hands. Avoid touching your eyes, mouth, nose with the unwashed hands. Avoid close contact with people who are sick. So that is Alabama. Now, this is the Eurosurveillance, and this is Scotland's report. So Scotland's report is from January 1 till 12 April, and this report is published on, I believe here, 14 April 2022. So in this one, this is a very detailed report. I'm not going to go over all of this. I would actually request you, the link is in the description to go over this. I have discussed some of these points in there. Interesting is that Scotland is creating a working case definition. So a confirmed case includes anyone presenting since 1st January 2022 with aspartate transaminase or ALT, alanine transaminase, greater than 500 international unit per liter of unknown cause, who is either age 10 years and under, or who was a contact of any age of a possible or confirmed case. So any other person who may be sick with hepatitis, regardless of the age. A possible case is defined as a person presenting since 1st January 2022 with jaundice without any known cause, either age 10 years and under, or who was a contact of any age, if possible, of a possible confirmed case. So they had 13 confirmed cases have been identified in Scotland, 12 of whom presented in March and April. Median age 3.9 years and interquartile is 3.6 to 4.6 years. 7 of the 13 children were female, all were white Scottish ethnicity. Then look at the symptoms. Symptoms reported include jaundice, 8 of 9 cases, abdominal pain, 7 of 9 cases, and nausea and malaise, 6 of 9 cases, leading up to admission. Nearly all of them reported GIT symptoms, including diarrhea, vomiting, and lethargy, but not fever in the weeks before admission. And fever would then give you the clues that did they have bacterial infection or fungal infection or supra-infection with these. So all cases had been admitted to hospital for a minimum of 6 days. 5 still remain in hospital, including one in England who has successfully undergone a liver transplant but remains in the hospital. Now, they have done another very interesting thing, and that is they have, for each case, they've done various labs that they did and the results. For example, hepatitis A, this case number 1. Hepatitis A negative, B negative, C negative, E negative, SARS-CoV-2 negative, adenovirus negative, other positive results, ASO lesser than 20. And so they have given all of these. So I would once again request you to look at it. They still do not have a confirmed pathology or etiology. They suspect it is adenovirus. So let me go. So 5 of the 13 cases had a recent positive test with the SARS-CoV-2. 2 that were 3 months before admission, 2 within 11 days of admission, and 1 point of care test was positive upon admission, which was not confirmed by PCR. Population prevalence of SARS-CoV-2 infection was highest in February and March 2022, at the time when the predominant variant was in Scotland was Omicron. So look at this. Adenovirus circulation in Scotland is seasonal and will with peaks commonly seen between February and April. So here is their hypothesis. This is again Scotland. Initial hypothesis about the etiological nature of the severe hepatitis cause possibly included either an infectious pathogen or a toxic exposure to food, drinks, or toys favored by younger children. So then they say at the time of publication, the leading hypothesis center around adenovirus, either a new variant with a distinct clinical syndrome or a routinely circulating variant that is more severely impacting younger children who are immunologically naive, who are not exposed to this virus before. The latter, why would they be immunologically naive? The latter scenario may be the result of restricted social mixing during the COVID-19 pandemic. Adenovirus infections as a cause of severe hepatitis is rare in immunocompetent children, but has been reported in case reports and series. So those children who are immunocompetent, they usually do not have adenovirus severe infections or adenovirus infections, but they say that these have been reported. So it's not zero that it should not happen in immunocompetent children. Other infectious causes still being explored include increased severity of disease following infection with Omicron BA2, the dominant SARS-CoV-2 virus circulating in Scotland, or infections by an as yet uncharacterized SARS-CoV-2 variant. Of note, none of the children were vaccinated. In novel yet vaccinated against SARS-CoV-2. A novel or yet undetected virus also cannot be ruled out. So this is their discussion. Then there are some more links. I'm not going to go over these, but if you get a chance, please look at them. What is hepatitis? What are various kinds of hepatitis is, and how do they transmit? That is here. Then what are the blood specimens with EDT and not? Then there is a interesting report here as well, which kind of pulls this data together. And then this is also interesting. This is the dozens of unexplained cases of liver. I thought this was a good write-up as well. This is wiki, but you can consult whichever book or source you like about transaminases. And finally, we will be doing a quick chit chat on this channel in a few minutes. So if you have a question, we can answer them there. I'm going to put that link over here, and I would see you on that side. So with this, my apologies. I'm a little sober with this because, of course, it's small children, and I'm very, very sensitive to the children's situation. So I just cannot be myself when I discuss children. So my apologies for that. Do me a favor, if you would like to support this work, please like, subscribe, and share. That is the easiest and quickest you can do. If you would like to support further, you can buy a DrBeen account. There is a link in the description of this video, and that is really, really affordable. Otherwise, you can also use PayPal to support this work, or you can use Buy Me a Coffee, or you can become a patron. With this, I would see you on the Chit Chat channel in a few minutes. Bye for now.